Medical tests. Here's some common ones, and we'll go over both abnormal and normal examples. Let's go. This is a chest x-ray, and what do you guys think? Is it normal or abnormal? So this one is actually abnormal. If you look at the cardiac silhouette, that's the shape of the heart in the middle of the chest, you'll see that it is enlarged. It's greater than 50% the width of the thorax. So this is a sign of dilated cardiomyopathy. It's an enlarged and weakened heart. But one good thing is that I don't see a lot of fluid building up in the chest. Oftentimes with cardiomyopathy, when the heart is weak, it's not pumping properly, you can end up with congestive heart failure, where fluid builds up in the lungs or around the lungs in what we call pleural effusions. But we don't see that in this x-ray. Now, for comparison's sake, let's look at a normal chest x-ray here. You can see that the heart is much smaller in size, way less than 50% the width of the thorax. Moving on, what about this one? Is this normal or abnormal? Well, first of all, what is this? So this is an EKG. It's a cardiac tracing. And in this case, this one is actually normal. You see nice narrow spikes. These are the QRS complexes that correspond to the heart contracting. This is a what we call normal sinus rhythm. Now let's contrast this one with an abnormal EKG, which you see here. This one, first of all, what do you guys think is going on here? So if you said heart attack, you would be correct. More specifically, this is an inferior STEMI or ST elevation myocardial infarction. If you look at leads 2, 3 AVF, you see the tombstone pattern right next to the QRS complexes. So this is definitely abnormal. And this EKG would actually cause some alarms to go off. If this happens in the emergency department, a cardiologist would be called right away. You would want to get this patient to a cardiac catheterization lab right away for revascularization. Okay, moving on. What about this? Is this normal or abnormal? So here we're looking at a CT scan, and this is a bit of a cop-out because when you look at cross-sectional imaging like CT scans and MRI scans, you don't really just look at one picture like this. You'll scroll through all of the images to get a 3D image in your mind about what's going on in the body. These scans, you can imagine the patient would be laying on his or her back with the feet sticking out of the screen, and it cuts the body in half. But we're just looking at one image here. And so what do you guys think? Is it normal or abnormal? In this case, this is abnormal because on the right side of the image, you can see the liver and it's enlarged. So we call this hepatomegaly. In this case, there are fatty infiltrates in the liver. How do I know that? Just based on the fact that the liver appears darker than its neighbor, the spleen, which you see on the other side of the image. The spleen doesn't have any fat. And so because the liver now has these fatty infiltrates, it appears darker on the image. So definitely an abnormal CT scan here. Okay, so we took a look at a chest x-ray, we looked at an EKG, and now a CT scan. So I guess we can move on and check out an MRI scan. So it's kind of related to a CT scan in the sense that it's also cross-sectional imaging. It's cutting the body in half. Now here's an example of an, did I just spill the beans here? Of a MRI scan, is it abnormal or normal? So I kind of partially said it already. This is abnormal. You're looking at a stroke. So the white areas on the image correspond to parts of the brain that were damaged from not getting enough blood flow, thus resulting in a stroke. Little way to cheat a bit, or at least get your feet wet reading MRIs of the brain, is to look for symmetry. So for the most part, the brain is pretty symmetrical when it's normal. If there's anything that's glaringly asymmetric, like what you see in this image, that should raise some concern that there's something wrong. Okay, that's all I got for today. Thanks for checking out this video. If you found it helpful or entertaining in some way, feel free to hit the subscribe button there or check out another video here, and I'll see you guys next time.